Hello, you've reached Placid Wave, the leading health tourism company, where you can compare the most affordable treatments worldwide. Subscribe to our YouTube channel and get instant access to all of our latest health videos.
Hello Alex, thanks for coming over here. Welcome to Seoul.
Thanks, Doc. It's nice to be here.
So let's start with, could you please introduce yourself?
Okay, I'm Alex Britton, and I'm a visitor to South Korea. I work over here, and I'm from the United States. And I work as an industrial hygienist, which is an allied medical profession. So,
Okay, so may I ask you how we first met? So in the meantime, you had a history, came over to my office, right? So could you please tell me, in your point of view, how it happened?
sure, and if I get long, tell me. I actually had the surgery long ago, back in 2010, and my prosthetic stopped working, and I accepted a job in South Korea, and the prosthetic stopped working right before I started over here. And so we had surgery to replace one right before I traveled over here. And when I got over here, it actually opened up and failed. And so I needed medical attention immediately. They sent me to a local hospital. Had a very good doctor, but he was not aware of what the problem could be because it kept, the nature of the problem was it was opening up.
Okay, so in short, you had an original penile prosthesis, and it worked well for about 5 years, right?
Just about, yes.
Yeah, 5 years, and then it had mechanical failure, I'll say. After that, you had a revision surgery in the U.S., and right after that, you came over to South Korea, but the scrotal incision wasn't healing well. So you visited a local urologist, but after several trials, it didn't work well. So he recommended you to coming over to me, to my practice.
Yes.
Okay. What I want to ask you another thing is that how you felt in the beginning and after you had a penile prosthesis, and after it stopped working, and then it got infected, and then you now have it working it well. How did your emotion change it?
You know, we men are supposed to be strong and never complain, and when we're met with something that's emotional, we kind of close down. But when you lose your ability to get an erection, that's your manhood, that's who you are. And if you're unable to do that for whatever reason, it takes something away from you. And I was depressed. I was depressed because, you know, The way it happened was I basically injured it. And had to have the prosthetic put in order to maintain an erection. And so I was really depressed, and when I got the original unit in, it wasn't, it was in place for a short time, and it wasn't put in by an expert, but it was. I was able to get an erection, and I was able to please my wife, and that's one of the big things that we've not talked about is I was depressed, but my wife, she got into a marriage to be with me, and I couldn't do what I, to fulfill my obligation as the man. Anyway, so she was glad that I did, and then when it stopped working, that was that was disastrous, because you certainly don't, although your surgery was probably easier than some of the others that I'd had, or one of the others that I'd had. You really don't like being worked on. Nobody likes being opened up and having surgery. So it was not something I was looking forward to, but it failed, and I found somebody to replace it. But the two doctors in the U.S. that I went to, they did not have extensive experience like Dr. Park. One of them had done 2 insertions in 2 years, and another had done maybe 1 in the last year, and they just I didn't get a sense of confidence in them. Although they're very good doctors, they're very good urologists, they just did not have that specialty. And when I got to Dr. Park, it was a whole different story, and it's nice to be taken care of by a world famous urologist that specializes in this, because he knew exactly what the problem was. When I went to the local South Korean hospital, the doctor had some real difficulty trying to figure out what it was, but he described the symptoms to Dr. Park, and Dr. Park immediately knew what the situation was, and I went to see him, and we had a kind of a long situation where a couple of...
Yeah. So, in short, you had a desperate feeling. Not just because you couldn't have an erection back, but because you have your own relationship with your wife, which means a lot to you. But not just you, but your wife as well was depressed because of this, I'll say, a minor health issues. But now, as you get it back, you feel way better. I believe not just because of you can have now intercourses, but in terms of a man in a whole, as a whole set, whom we should be. you get it back what you had to have. Am I right?
Yeah, it's like it's kind of like a female when you hear that they've lost the ability to have children, or they've had to have some part of their body removed because of something. You lose yourself, and it's the same way with a male. I did not have this surgery so that I could go out and have sex with everybody that I found. That's not who I am. I'm monogamous with my wife. But the fact that I couldn't even do that was very depressing. And even now, my wife is not with me. She's back in the States. But just to know that if they wanted to do something about it, they could do something about it. I am of the belief I won't do that, but just knowing that somebody finds you attractive and you're able to do something about it if you chose to, it gives you a bigger sense of comfort in yourself. And I don't know how to say it eloquently like some people do, but I have it back, and it wasn't just to have an erection. It's basically I'm able to again, and I'm sure my wife is happy too.
So far, I've seen almost all men didn't have this surgery to flirt out or to have aggressive sexual behaviors. No, they just wanted it back because it is what they should have. For example, when the woman has a mastectomy because of their breast cancer, majority of them will get a reconstruction. Why? Do they want to flirt out? No. Do they want to feed their baby? They can't. But because they have to have it to be a woman. In my eyes, the same happened to you as well.
Very well put. More eloquently than I did. It's absolutely.
So, lastly, for those who suffer in silence, they can't. Being a man, like you said, we have to be strong. We have to hold our feelings, hold our, necessities, or hold our, desires, right? But those who suffer in silence, as who has a erectile dysfunction but suffers, or who do not know what to do you have any recommendation or to tell them to help them?
Well, that's kind of why I agreed to do this. Is talking about one's is not real comfortable to talk about one's own situation, but I know that there's a lot of people out there that they should talk to their medical professionals, and they'll not only improve their own outlook on life, but their family. If you lose some process in your body and you're not whole, it not only affects you, but it affects your family and your loved ones. So, do yourself a favor and do your loved ones a favor, and seek this out. And I'm just fortunate that I ran into one of the foremost implant surgeons here in South Korea, and I must say that anybody that comes see you, Doc, is quite lucky, because you do it all the time and you're very familiar with it. So I'm being honest, and you probably don't like me saying that, but it's true. You're helping a lot of people.
Well, thank you for promoting me. And at the same time, thank you for your bravery. I've seen a lot of patients who know that they want to share their stories, but they fear then telling this in public may be a disgrace, or they are kind of really not comfortable with a situation like this. But thanks to your, honesty and bravery, I think many will benefit by to get the help, to get the courage again.
I hope so, because if we've helped one person, that's a lot of people to. Thank you, Doc.
Thank you for being my patient, Alex, as well.
감사합니다.
감사합니다.
Subscribe to our YouTube channel and get instant access to all of our latest medical care videos. Enjoy your free pass to quality global healthcare.